So now we'll go over 3 ways that you can use the Neopuff in your clinical setting. So one of the first ways that we're going to talk about is giving PPV to your baby. You're going to want to make sure that you have a mask that's the appropriate size and that you're checking the rim to make sure that it's inflated appropriately so you can get that tight seal around your baby's airway. You would place the mask over the airway, making sure that you're not putting any pressure on the eyes. And you're going to occlude the PEEP cap to give your breath. And you would use a rhythm of breathe 2, 3, breathe 2, 3, making sure that you don't occlude the PEEP cap for too long because you wouldn't want to maintain that pressure of 20 because that could damage your baby's lungs. Another way that we can use the Neopuff is to give CPAP. So CPAP is continuous positive airway pressure. And so that is the amount of gas maintained in the lungs between breaths for a baby that is breathing on their own. So that's 2 things that you would need to have in order to use CPAP. Your baby needs to be breathing spontaneously, and your baby needs to have a heart rate greater than 100. So in order to give CPAP with the Neopuff, you're just going to make the seal around your baby's airway and provide gentle pressure. And so with the CPAP, it's giving you what you have your PEEP set at. So right now we're giving this baby a CPAP of 5. And you would use this if you have a baby that's grunting, struggling a little bit with their respirations, not able to maintain their SATs. That's when CPAP would be appropriate use. You can also give blow-by. If you're in the delivery room and you have a baby that needs just a little bit of oxygen to help with the transition from intrauterine to extrauterine life, or you have a baby, say down in the NICU that's on the monitor, heart rate's above 100, the baby's breathing, but SATs are kind of drifting down, you could give a little blow-by, and you're going to do that by just capping the mask lightly over one side of your baby's mouth and not occluding the whole airway because that would be CPAP, and you're able to give blow-by like this. But remember, the amount of oxygen that you're giving is going to be what you have your blender set at. That's all I have to say.